SEQ.1 A 25-year-old poultry farm worker has been with the inability to open his mouth for the last 3 days. He injured his right foot 10 days ago but kept working barefoot on the farm without treatment. A. What is the diagnosis of a high index of suspicion? B. Outline the management plan with prognosis. Answer. A. Tetanus. B. Management plan. Isolation, quietness and comfort, drainage of pus and wound toilet will be needed. Human anti-tetanus globulin is given intramuscularly to limit the effects of free toxins. It should be used in doses of 25-500 units to give cover throughout establishing active immunity by giving toxoid. A seriously ill patient with dysphagia and reflex spasm will need to have a nasogastric tube passed and sedation continued. The diet, the need for intravenous nutrition, the maintenance of balanced protein intake, and renal function and cardiac function will be priorities. A tracheostomy should be considered if the patient has any difficulty in breathing. The meticulous care of the tracheostomy tube includes suction and humidification. Prognosis 30 to 40% mortality in moderate to severe disease. A 15-year-old schoolgirl presents with a 2 by 2 cm nodule on her left supraclavicular region for the last 4 months. She is having sweats at night and her sputum contains blood. She has lost about 10% of her body weight meanwhile. A. What is the likely disease causing swelling in her neck? B. How will you investigate her problem? Enumerate the necessary ones only. C. Name 3 components of management. Answer. A. Tuberculosis lymphadenitis, cold abscess. B. Sputum for AFB in malignant cell, X-ray chest, FNAC or excision biopsy swelling, ESR, baseline liver function test and ophthalmoscopy. D. Confirmation of diseases, nutrition and hygiene, anti-tuberculosis drugs, follow-up to see the response and any side effects of drugs. A 40-year-old garment factory worker reports with 1 by 1 cm ulcer on the right side of her oral cavity for 2 months. She is a habitual pan eater. She also notices a 0.5 x 0.5 cm nodule on the upper part of the neck on the same side. The surgeon examines and advises. A. What is his main suspicion? B. Why has he come to this conclusion? C. How should he proceed scientifically for the best results of treatment? Answers. A. Carcinoma of the oral cavity. B. Because the ulcer has an enlarged neck node and she has a risk factor of pan-eating. C. Incisional biopsy of the ulcer, FNAC of the cervical nodule, CT scans of head and neck, MRI. USG abdomen. 6 days after an exploratory laparotomy for a perforated appendix, 50-year-old diabetic lady with a moon face, looks toxic and has gangrene developing around her abdominal wound. As attending surgeon. A. What is your main concern regarding the illness? B. Your diagnosis is further strengthened by the presence of specific features. C. In a few words outline the management. Answers. A. Synergistic gangrene with septicemia. B. Diabetes mellitus, Cushing's syndrome, old age lady. C. Broad-spectrum antibiotics, benzylpenicillin, metronidazole, gentamicin. Debridement of the wound, control of blood sugar, monitoring of vital signs and intake and output charting, blood transfusion, secondary wound closure or skin cover by grafting is only attempted after the infection has been completely eradicated and health granulation tissue has formed. A 77-year-old housewife presents with 5 by 5 cm swelling on the right side of her neck which moves with deglutition. She has a normal voice and some difficulty in swallowing. Her pulse is 78 per minute. She is not using any drugs. A. What investigations you will ask for in this patient? B. What diagnosis on one investigation can lead to the suggestion of an operation? C. Name 3 complications which can result from operation for this problem. Answers. A. Thyroid function test, FNAC, indirect laryngoscopy, X-rays thorax inlet. B. if FNAC swelling shows malignancy. C. Hypothyroidism, hypoparathyroidism, injury to recurrent laryngeal nerve, recurrence of disease, hemorrhage, primary or reactionary.